Today we're going to do a Revlite skin rejuvenation and pigment removal treatment on a patient. Our therapist today is Ruby Giles, and she's going to be undertaking the treatment. Ruby has already cleansed her face, which she's going to just give another wipe over to prepare Kate's face for the treatment. The Revlite is really nice for tightening skin, rejuvenating and making your skin look more youthful, reducing the pore size, and something that most lasers can't do, and that is it remove melasma. So a lot of ladies have these sort of dirty patches of skin on their face that they wonder where do they come from. They're a hormonal pigmentation which is actually brought out by the sun. So the other name for them is called mask of pregnancy. On the sides of Kate's cheek she has a small amount of melasma, and she likes to keep this under control by doing Revlite treatments every couple of months, and it also helps her to have youthful skin. So Ruby's now just putting on the protective glasses. She's put tissue underneath the metal goggles just to make it a bit more comfortable around Kate's eye area, and she'll set up the laser in a moment and get the right sort of setting for her treatment. So once the goggles are in place, the laser will be set up. The other thing that at the Laser Skin Clinic we use a Zimmer cooler. Now this is a medical grade cooling machine, and it's very important in relation to patient comfort. We have the patient themselves hold the tube where the cold air comes out so that they feel a bit more under control. So Ruby's just going to get that Zimmer cooler for Kate, and she will be able to therefore have the comfort on that for her treatment. It makes a little bit of noise, but it's worth it in relation to the comfort for the patient. And now Ruby's putting on her protective glasses, and once the laser is ready for the treatment, she can go ahead and start the treatment. Are we waiting for the laser at the moment to prepare? Okay. So after the treatment, Ruby will put sunscreen and on Kate, as well as some pure pharmaceutical grade minerals, so that any slight bit of redness will be covered over and she can go straight back to work. This is one of these treatments that you can basically have as a walk-in, walk-out of the clinic treatment. It's particularly beautiful also for people with darker skin because they're more subject to uneven pigmentation, and it's very safe for them and doesn't cause any of the normal problems that many lasers do, where as a result of laser treatment they get darker marks, which is called post-inflammatory hyperpigmentation. This laser is very good for being safe and not giving those problems, and we can do all skin types on the Revlite laser here at the Laser Skin Clinic. Just waiting a little bit more for the laser to be ready. Is that cooling air a little bit cold before you start the treatment, Kate?
Yes, lovely.
Yes. And how was the treatment last time when you had it, and the things that you noticed with your skin?
I noticed the tone of my skin is a lot better after a treatment, and my pore size is definitely reduced, but also my pigmentation is reduced, which I love. And that side of my melasma has broken down quite significantly.
On the left-hand side, yes.
Yeah.
This treatment is relatively comfortable to do. It's Now, of course, you have some sort of it's a very quick laser. It goes at 10 hertz, so that you have to keep the handpiece moving, and we go and do several passes over the skin to get the desired results. Afterwards, Kate might have a slight amount of redness, but this usually resolves very quickly. The next day people wouldn't have it, and you certainly can easily cover it over with the minerals. Some people might have a bit of redness for a few days longer, but it will always resolve. We never have any negative side effects from the Revlite laser treatment. Basically, because this is the laser light in this machine, it goes out in nanoseconds, which is 1 million times shorter than the millisecond lasers. For example, the Alexandrite, which is our Candela Gentle laser, or the Gemini laser. The pulse width there is in milliseconds, whereas this is in nanoseconds. So that makes quite a different treatment, and it allows for you to have skin rejuvenation treatments using different modalities and therefore get better results, because it's always great to use different lasers so that your skin just doesn't get used to it and stop having as much collagen stimulation, because this is really fabulous for collagen stimulation. We also have patients who particularly love doing this one for their under eye area, because the skin under the eyes can tend to get a bit saggy, and this has a tendency for tightening. In fact, immediately after the treatment, people do comment that their skin feels tighter, and it doesn't just feel tighter, it will look tighter. So how's that feeling for you, Kate? Now, of course, the nose area is a little bit more sensitive, but as you can see, that's still quite bearable. If you found that you couldn't tolerate this without numbing cream, you can have numbing cream, but it's very rare that people would say they need numbing cream for this particular laser when they're doing a skin rejuvenation treatment. Now Ruby has finished with that treatment, so she'll just pop the laser away, and then she'll be taking the goggles off and putting some after treatment serum on Kate, as well as some sunscreen and minerals to prepare her so that she can do her work.